So today I'm going to be treating the wrist using the Enraf Nonius Tecarpuls. We're going to be coming into the wrist in carpal tunnel syndrome. As you can see here, it's selected level 8 and 4 minutes for the treatment time. Using the small treatment head, so 4 minutes might not be too bad. You don't want to preload too much heat, so level 8 is fine. Seen from the perspective of the therapist, just bring the thermal camera in, you'll see it's about 31 degrees, 32 degrees. It's fairly normal for the wrist. It's often a little bit hotter than other parts of your body. Not a lot, but a little bit. I'm going to bring in the earthing electrode and just apply some contact medium to that. And just spread that contact medium out. And then we'll put the earthing electrode underneath the patient's arm. Let's get the patient to rest down onto it. I want to be using the smaller treatment head today rather than the large treatment head. Fits on the wrist better. Tend to go for 1 minute treatment time per size of treatment head. Apply some contact medium, enough to do the area, but also a little bit extra. It will dry out, so I like to put a little bit extra on. Start the treatment and just start moving around in fairly rapid circles. This is an area that will accept heat quite readily. Perfectly fine to come down into the hand. You can actually do this treatment on either side of the wrist. If you look at the picture included for the preset protocol, it actually shows treating the wrist from the other side. You can actually do this from either side, but I prefer to do it on the more painful side for most people, which is the palm side, rather than on the back of the wrist. But you can do this from both sides. The heat will go through the whole of the wrist. It's just not that big an area in most people. Now, this is a fairly lengthy treatment, so I'll skip forward to the end of the treatment and then we can see what the results are. Towards the end of the treatment now, you'll see there's some flushing of the skin, some redness, some erythema. Best used in chronic conditions. So bring the thermal camera back in. We'll see that we've gone up about 2 degrees. So not as dramatic as some other parts of the body, but certainly a good increase in temperature and good for chronic wrist conditions.